Hello friends, myself Dr. Mohita Goyal, Senior Gynecologist at Sahyadri Hospital Nagar Road. Continuing with your series on vaginal health, I am now talking on the abnormal vaginal discharge. In the first video, I spoke around what is normal vaginal discharge. This video, I will be explaining the different types of discharges which are seen in different sexually transmitted diseases, so you are able to differentiate between a normal and an abnormal vaginal discharge and consult your doctor on proper time. The normal discharge, as I told you, is clear, transparent, and it's watery, and it has no odor. But when the discharge is thick, like curdy, white, and it is like in clumps like cottage cheese, this is typical of yeast infection or candidiasis. The candidiasis is not an STD. It is caused because of the change in the pH balance of your vaginal fluid. It can happen if you are on OCTs, or you are taking too much of stress, or you are on antibiotics, or you have diabetes mellitus. So this discharge, curdy, white, thick, is typical of candidiasis. Now if the discharge is grayish white and it has fishy odor, it is typical of bacterial vaginosis, commonly known as BV. It is because your normal bacterial flora gets altered. It may be again because you are on OCTs, or if you have change in a sexual partner or multiple sexual partners, or when you are douching excessive, and even smoking causes bacterial vaginosis. Now, if the discharge is greenish yellow, it is typical of trichomoniasis, and this discharge is frothy and it is maybe associated with pain and inflammation around your private parts. This is a typical sexually transmitted disease. It can even spread through sharing of towels and napkins. And the second, if the discharge is cloudy and yellowish in color and associated with painful micturition, that is pain during urination, it is typical of gonorrhea. It is again a sexually transmitted disease. Now, if the discharge is associated with itching and painful blisters around your private parts, it is because herpes infection. Now, the discharge, when it is normally clear, but if it is a blood-stained discharge, it can be because of your irregular periods, left over a foreign body inside the vagina. Sometimes you forget tampons. We have seen the patients, they come after weeks of their sexual intercourse and the condoms is left inside the vagina. It may cause infection, or it may even lead to blood-stained discharge. The blood-stained discharge, as I told you, can be because of irregular periods. It can be because of cervicitis, that is infection and inflammation of the cervix. It can be because of the polyp, cervical polyp, and sometimes it may be a more serious condition, that is cancer of the genital tracts. So whatever discharges I have explained you, I have told you right now, they are different from the normal vaginal discharge, and in such cases you should not delay and consult your doctor for the appropriate treatment. If you have any queries, you can consult or you can call on the numbers given below, or you can put on the comments. Continuing with our series Vaginal Health, I will coming with the next topic soon. Thank you.